We will first begin by talking about type 1 diabetes. Type 1 diabetes is caused by an autoimmune beta cell destruction. Type 1 diabetes is usually developed at a young age, although it can occur in teenagers and adults. Genetics and possibly certain environmental viruses play a role in who develops this disease. In type 1 diabetes, your body attacks its own pancreas, specifically the islets of Langerhans. When that mechanism is destroyed, your body cannot properly regulate the hormone insulin. Your body may then produce little to no insulin. Without a properly functioning pancreas, you cannot properly control your blood sugar levels, which equals little to no energy. Sugar is needed for the cells in order to function properly in your body. With no control on how the insulin is produced, complications like hyperglycemia or high blood sugar can occur. Risk factors of type 1 diabetes includes a family history of diabetes, genetics, and age. Complications also include an increased risk for heart disease, neuropathy, which is tingling and numbness feelings you can feel in your fingers or feet, which is usually caused by uncontrolled diabetes. You can also have eye damage, kidney damage, reduced skin integrity, pregnancy complications, and more. Unfortunately, there is no cure for type 1 diabetes. However, there is treatment options available that can help increase diabetics' quality of life. Treatment for type 1 diabetes include lifelong insulin administration, diet, and lifestyle changes. We will now talk about type 2 diabetes. In type 2 diabetes, your body's pancreas becomes resistant to insulin due to the loss of beta cell insulin secretion. Your body may still produce insulin, however, the cells resist that insulin. In type 2 diabetes, your body develops a resistance to the hormone, insulin. The person usually is hyperglycemic for a long time without any knowledge. Over time, the body cells become less responsive to the insulin, and they develop a resistance. The pancreas tries to keep up with the high circulating blood sugars, however, it cannot, and it fails over time, and the blood sugars continue to increase. Some risk factors include a family history of diabetes, being overweight, especially if you carry fat in your midsection, sedentary lifestyle, age, and ethnicity. Some ethnicities are the following: African American, Alaska Native, Native American, Asian American, Hispanic, Latino, or Pacific Islander American. Unlike type 1 diabetes, where you have to have insulin for life, type 2 diabetes can be managed through diet and exercise. There are times when type 2 diabetics do need insulin or oral anti-diabetic medications. However, this is not necessary in order for them to live. It's important that when you're diagnosed with diabetes that you understand the difference between hypo and hyperglycemia. On this slide are listed some symptoms that are associated with hypoglycemia. Anytime you are hypoglycemic, that means your blood sugar is less than 70 milligrams per deciliter. It's important to ingest a fast-acting carbohydrate like gel, juices, soft drinks, or candy. It's always good to have a candy that's easily dissolvable in the mouth just in case you are hypoglycemic and are beginning to lose consciousness. What exactly is insulin? We keep talking about insulin, but we haven't really identified what it is. Insulin is a hormone that your body produces. Your pancreas is made up of cells called islets or islets of Langerhans that produce this hormone. When you eat, the sugar from your food enters your bloodstream and your blood sugar levels increases. Your pancreas detects this increase in blood sugar and releases the hormone insulin. Insulin is distributed into your bloodstream, allowing the glucose to be taken up by the cell. It works almost like a key to open the cells up so they can be able to take in glucose. As your blood sugars begin to drop, the pancreas detects that, producing less insulin. When preparing to check your blood glucose, it's important that you gather all your supplies prior to beginning. The first step to checking your blood sugar is to wash your hands with soap and water. After, you want to prepare the lancing device by inserting a brand new lancet. You do not want to reuse old lancets because this can increase your risk for infection. Third, you want to prepare the glucometer by inserting a test strip. Once you insert the test strip, it should turn on the device and start flashing a blood droplet. That means it's ready to go. Number 4, you're going to prick the fingertip to obtain a drop of blood. Number 5, you're going to apply that blood onto the test strip. Number 6, the results should appear after a couple of seconds. After the results appear, you want to be sure that you write that down in order to keep a log for your doctor. Lastly, you're going to dispose of all the lancets or all your sharps into a sharps container. Be sure to go back to the YouTube page now and click the link that says Post Test.